Good afternoon, Dr. Sharma, and welcome again to another session on mental health.
Good afternoon, Dr. Vasconcelos. Good to be back.
Doc, I would like to ask you a few questions relating to our children, and specifically in the area of teenagers. They have to deal with a lot of negativity. Many are limited with with access to their friends and their routine. And so there's a lot of stress on teenagers right now because we're more social beings than anything else. What would be your recommendation to teenagers right now who are dealing with so much negativity, and how do they cope with it in a positive way? What steps can they take?
Thank you, Doc. Good question, and very pertinent to what's happening to their lives as they have to be in a different type of lifestyle from what they're accustomed to. And teenagers are very social people and love to be with each other. They're they probably don't take restrictions very well. It's a concern, and I can understand why the system is taking those measures because there would be a hard route to control. It's one thing to tell them to say put on the mask and keep social distances, but for that to apply well to teenagers is a bit harder because they tend to be more persons who don't believe in being vulnerable. For one thing, they think that they're invulnerable to all kind of obstacles, which is a good mindset, but it can make them break the social barrier issue and maybe lead to infection. So they've had to be put into a situation that's unnatural for them. It's a hard thing. And sometimes they can be in a home where parents need a little bit of space and privacy and they start to get on each other's nerves. So it's a difficult time. Hopefully that will change. They tend to be very physical persons. They like to hold, touch, feel. So again, keeping them at social distances in a school setting is hard. So we feel for them, and I'm glad that we can talk a little bit about their personal feelings and how we can work with them to get them to feel more better, to be more positive in this very negative times that we live in. One of the things I think is useful for our youngsters is to try to maintain a structure, a balance, keep the school activities as separate from much as separate from social activities. The social media activities are very much there in our lives at the moment, and more so in our teenagers' lives. So I think trying to keep that limited is important. And working to get them to be self-disciplined is critical. So while the parents will be on their cases and try to get them off their phones and say, well, go study, go do something that appears more productive, it's a challenge. So we don't want it to be a battle at home, but make it a comfortable time where both parties are enjoying each other's company. So I think structures is useful so that the person knows that they're working this day from the morning or even the night before. They plan the day, the next day with the parent. It's going to work better, and they become a vague set of rules that must be followed. So there's a fair amount of structure developed for the youngster. It can help them guide their time. So parents need to be more in the role of guidance figures and control figures. So young persons at that age time tend to want to be more independent. They want to gain autonomy. They want to be more self-directive. So they don't want to have the parents directing each moment. So giving them the freedom to think and to develop their own learning plans in their own time. So it's not a school environment now, it's a home environment which has to be modulated to be school, academic, social, interplay between friends, family, and media, which is another big family now. So finding that time, finding that structure, and I think also finding time for self-reflection, quiet time, meditative time, spiritual time, exercise time should all be woven into that day, that it becomes a very healthy, wonderful day. To keep it. So my point, Doc, is that the structure needs to be developed, but not to the point where it becomes too rigid. There should be flexibility, but there should be a general feel of what should be done. And there should be a reflection time at some point in that day where the mom, the dad, the parents, the brothers and sisters can all join together as a family and say, how has our day been going? What have we benefited from this day? What have you done that's positive? So that's my take on that. Yes, go ahead, Doc. I see a question coming.
Yes, Doc. Right now in the United States, the numbers are really outrageous. It's a reflection of lack of poor leadership at the highest levels. Now, schools are, some schools are opening because of the suggestion of individuals who do not have the expertise like yourself, people who deny the science. And so schools are opening, and we know based on just common sense, teachers will die, students will die. It's going to be catastrophic, to say the least. What would be your recommendation now to teachers who are returning and have to deal with teenagers and just students in general within the settings of a local school?
A very good question. I actually did a program for the Caribbean teachers and teachers in Guyana where I live in. So it was very valuable to research some of the things and tools that we can use. And I think it's now a time for a new way of teaching, a new curriculum that involves more understanding by students of the importance of developing empathy skills, learning self-discipline. So it's not just about learning the subject material, but also learning the tools to make persons successful in the future. And I think this crisis can help us develop that type of new curriculum that will be more broad, more valuable in life than just subject oriented. So that's one side of it. In terms of the actual strategies for teachers to take up, I think protection is critical. Working with the youngsters to understand, get them to understand why rules are being applied and the importance of following those rules. Not make the classrooms a center of fear and friction, but let there be respect for each other, respect for the rules. With proper guidance, the young people will follow. It's all about guidance. We got to give them the guidance. To let them go in a free for all is not healthy. So putting those programs in place, there can be methods taken to have less persons in the class, what we call the hybrid schools, where some persons are at home learning and some people are in class. So there's a challenge now that we and the education system have to take up. Teachers have to have a lot of patience now with the new measures that have been put in, and they've been asked to take up that role. It's another challenge to them, and I think it's also important to ease up their stress in terms of more self-monitoring. So even the evaluation of our young people can change. Even the teaching styles that we use can change. So there's a flipped classroom programs that we use in medical school that work very well, where we don't have to stand and deliver lectures all the time. We can actually have the students learning material ahead of time and use group sessions to discuss the material. So I think we've been pressed now to find new modalities that are very attractive. And I think it's also a good time to put those in place. The old models are not necessarily the best model. the work, and we can start to make those changes. I think some of those plans should be discussed with the parents ahead of time. So again, be prepared. To be prepared is always the best way to go forward. Have our parents involved in those plans before they're put into place, before they're actually made into action plans. Have a discussion. The teacher boards can meet with the parents through the virtual media as we're doing. Can happen.
Well, Doc, I thank you so much for your love of educating people, your commitment to helping people, to serving humanity. We've worked together in Guyana. And as a matter of fact, I look forward to our mental health clinic that we'll be doing in the early future once we're able to go back to Guyana. But thank you so much for all you do. And any final thoughts?
Yes, I think the teachers have the willingness to change. I think it's got to be driven from below by our parents too. While also listening to our children, what they feel works best for them. So it's got to be, a process that is around that goes around and addresses all people, a 360-degree process. I fully agree with you that the clinics that we do in Guyana have paid off well. I've seen how you deal with the children in the schools and the teachers and the warmth that you greeted with. So it can happen. It's just the need, the willingness, and to make the action now reality. So I look forward to you coming back, Dr. Vasconcelos. Once you're here, your spirit infuses everybody. So somebody has to make it happen. And I hope through your programs, through your work, change will take place for all our people, for our teenagers, for children who are younger than the teenagers, and for the older kids in university.
Amen. Well, thank you so much, Doc. You are a blessing. God bless you, and I'll see you soon.
Thank you.